Hello, everyone. My name is Matthew Webb, and I'm a student physical therapist with a CSCS and a BS in nutrition science. Today, I'm going to be talking about calcium. This here is going to be the 12th in a series of educational videos intended for healthcare professionals to help us in direct access healthcare fields become more adept at identifying nutritional deficiencies so that we can get patients presenting with one of these diseases the help that they need. So, without any further ado, allow me to present to you calcium. Firstly, we're going to go into the very basics behind deficiency of calcium. Then we'll break down the science behind why patients are presenting the way that they do. Then I'll give you some takeaways to help you identify this disease. When a patient has calcium deficiency, they can develop numbness around the mouth, tingling in the hands and feet, and decreased bone density. And we'll go further into the science behind these presentations and the risk factors later in this presentation. But I just wanted to provide you an idea of what we're going to be getting into in this lecture right here. Right, this is a calcium video, so you knew this was coming. This is the bone formation slide. So as many of you know, calcium is a fundamental part of the building block of bone, which is hydroxyapatite crystals, which you can see on the bottom left of the slide. Hydroxyapatite comprises the rigid portion of our bone matrix. When blood calcium decreases from deficiency, osteoclast activity is upregulated to help maintain blood calcium levels, which will be necessary for maintaining vital bodily functions, such as nerve action potentials. In this scenario, bone density would decrease, which would increase risk of osteopenia and osteoporosis. As I just mentioned at the end of the last slide, calcium is important for nerve action potentials. This is because when the action potential arrives in the axon terminal, the positive charge causes voltage gated calcium channels to open, generating an influx of calcium. Calcium then interacts with enzymes in the axon terminal, which ultimately frees synaptic vesicles to release their neurotransmitters in the synaptic cleft to cause either excitation or inhibition at the postsynaptic neuron. Here are some risk factors you can look out for. Alcoholism impairs calcium absorption due to intestinal damage. Kidney disease impacts calcium in a variety of ways. One way is that it can cause phosphate levels to rise. Phosphate can bind to calcium in the blood, decreasing the amount of free calcium able to fulfill its role. Celiac disease is another risk factor because it can cause intestinal damage and decrease absorption. As far as drugs go, corticosteroids can increase calcium excretion, proton pump inhibitors can decrease calcium absorption, and loop diuretics increase calcium excretion. Subjective questions to ask would be about past medical history. You should make note of kidney disease and celiac disease. Ask them what medications they're taking. Make note of corticosteroids, PPIs, and loop diuretics. Ask about any alcohol consumption, and of course, find out what that looks like. Diseases that individuals can be at greater risk for of calcium deficiency are cardiovascular disease, osteopenia, or osteoporosis. For clinical exam, neuro findings will include numbness and tingling around the hands, feet, and mouth. Main takeaways as far as the what, how, and why behind the presentation is that calcium deficiency can lead to osteoporosis or osteopenia. This is because calcium is vital to the structure of hydroxyapatite crystals, which are the fundamental building blocks of bone. When blood calcium is low, such as in calcium deficiency, osteoclasts dissolve hydroxyapatite to release calcium into circulation, which can lead to osteopenia and osteoporosis. And although osteoclasts break down bone in order to try to maintain blood calcium levels so our body can continue nerve conduction, this could still be impacted in deficiency, and we could see numbness and tingling in the feet, hands, and mouth. This is because when the action potential arrives in the axon terminal, the positive charge causes voltage gated calcium channels to open, generating an influx of calcium. Calcium then interacts with enzymes in the axon terminal, which ultimately frees synaptic vesicles to release their neurotransmitters in the synaptic cleft to cause either excitation or inhibition at the postsynaptic neuron. And when calcium is deficient, this process does not happen. And here are my resources. Thanks for watching. Note that I am making these presentations during a pretty busy semester, so I'm liable to make some mistakes. If so, let me know in the comments, and if your corrections check out, then I'll either add it to the video description or I'll pin your comment. If you learned something from this video and you want to learn more, continue on to the magnesium video.